Ladies and gentlemen, good afternoon. My name is Ondřej Dostál, and I am a politician and a lawyer, so I'm not going to treat anybody, unfortunately, and therefore I don't want to disturb you for making photos with these super guys. But I would like to say short remarks just before you recede to the buffet or try to get home through the strike in Belgium about what we are doing in the European Parliament. I happen to be a member of ENVI committee, which is for environment, and of Sant committee, which deals with public health. I well noted both what you were saying and both what is written in the materials which are available to us. So first of all, we need to concentrate on the scientific research on the causes, environmental causes, which create the possibility of getting cancer. And this is a big part of the environmental committee's work. But more to the healthcare level. In my country, which is Czech Republic, which is a middle-sized country in the central of Europe, we share many of the problems I was able to get from the report. And the first of them is early diagnosis. In my country, unfortunately, we had a well-developed health system, but it is for some patients very hard to even get to primary care. And then to get referral to specialists. Not for all. For most of people it is very good, but mostly the people who are most likely to be affected by diseases, who are not financially stable or who are not socially in a good position, it is increasingly hard to get to the preventive and treatment services, which increase the length between the diagnosis or the onset of symptoms, diagnosis and treatment. This is a thing we should concentrate more. European Parliament cannot decide for the countries how to organize the systems, but can help at least transferring data and share best practices. Secondly, getting actually the treatment. Lots have been said about clinical trials. Participation in clinical trials is an important thing, but more important is access to medicines and treatments. Concerning medicines, the registration, the approval of medicines which is done on the EU level is only the first part. The more important part, especially for countries which are not very rich and which are dependent, in which the citizens are dependent on the public system reimbursement, the more important is putting the medicines onto the list of reimbursed healthcare drugs. And this process should, according to EU laws, take no more than 180 days. Unfortunately, in some cases of some innovative treatments, it takes 2 or 3 years. This is an unnecessary delay for for patients accessing the treatment. Of course, they can buy the treatment because when it is approved by the European Union, by the officials, then it can be purchased. But for many patients, it is impossible to purchase them out of pocket. So the only possibility is to wait until the drug gets reimbursed, or to wage a very complicated fight with the insurance company for extraordinary reimbursement. And these are things which are legal in nature, which are unnecessary barriers, which complicate lives to many patients, and this can be improved from outside, and we will work on it. Then it is support for patients and carers after the treatment. This is also because the social and health responsibility is on member states. But this is also something we can at least support through programs which are being dealt with by the Sant committee. And finally, cooperation with patient groups, which is very important, especially when the patient themselves do not have access to medical doctors or to health care interventions on a timely basis. The patient movement is very important, and I hope that in the next financial program of European Union, we will find enough space, not only for green transition, not only for rearming Europe, but also for health. I won't disturb you any longer with the report from the European Parliament, but we take a good note on what happened here. I wish all of you good health, and I wish you also happiness, because this is very important. Thank you very much, and have a nice evening. Thank you.